So because the immune thrombocytopenia is a rare disease and characterized by low platelet count, which leads to increased bleeding tendency. And in elderly patients, they may have a higher risk for bleeding compared to their younger counterparts. And the results are not known in the real-world settings. The bleeding risk reported in clinical trials may not reflect the real-world rates, primarily because the patients participating in clinical trials are a highly select group of patients, often refractory with extremely low platelet level, and they often probably have a higher risk for bleeding. And also, the bleeding risk reported in clinical trials are affected by both the treatment group assigned and also by more often use of rescue medication. So that's why in our study we wanted to look at the real-world rates of bleeding related episodes in elderly patients to have a better idea what's their the bleeding risk and therapy use in the daily clinical practice setting. The primary finding is overall patients with primary ITP had on average nearly 2 BREs per person year, and the risk is highest within the first 3 months after ITP diagnosis, and then reduced to about half in months 3 to 12, and only as about 1/3 as high in 12 months after the ITP diagnosis. And we also find more than nearly 70% of patients have at least one bleeding-related episode, and the majority, more than half of them, were found with rescue therapy use. Are there other findings you want to?
Yeah, the fact that there was such a high proportion that were just defined by rescue therapy was significant in that, often we think of ITP as a disease of bleeding, but we don't capture the rescue medication use as part of the burden of the illness. So the fact that these bleeding-related episodes had a good proportion who had rescue therapy is significant for that reason. And we can't capture that kind of information in clinical trials because of the necessary use of rescue therapies. For ethical considerations, if a patient is considered to be at imminent risk of bleeding or is actually bleeding, they'll administer the rescue therapy in trials probably more often than what we see in a real-world setting.
I think in this study, we mainly just look at the bleeding and the rescue therapy use in this elderly population, and we didn't compare the effectiveness between different types of rescue therapy in this population. Maybe this would be like a further study question to address this question.
And looking at platelet counts, that was something we weren't able to do because it was a claims database. So that would be really important to tie the bleeding events and the use of rescue therapy to their platelet levels.
I think the finding is the bleeding rates and the rescue therapy use take all together as bleeding-related episodes. The rate is really high within the first 3 months after diagnosis. So I think once patients have the clinical symptoms of bleeding, and within the first 3 months are very, very important for clinicians to diagnose the patient's condition and give necessary treatment to help bring the platelet count back to normal range or not at risk for bleeding. I think that's the most important message, I think, and you can add some.
Yes, I agree, and I think also that often with this being such a rare condition, this is such a huge database. So it's a 20% sample of Medicare beneficiaries, and so I know that when I've talked to people about this study, they are blown away by just the sheer sample size of ITP patients that we have in this study. And the fact that they represent all comers and not, the most severe patients. So I think that this just gives clinicians a really good idea of what the burden of disease looks like in their patients.